Hi, my name is Audrey Husnitza, and I'm presenting my research proposal topic. The title of my research proposal is called Creating a Tapestry of Healing, a qualitative exploration of art, grief, and resilience in mothers bereaved by drug overdose. Drug use and overdose is a public health emergency. Globally, approximately 500,000 deaths every year are attributed to drug overdose, and 80% of those are linked to opiates. Opiates, the opiate crisis has been exacerbated by a triple wave epidemic, which includes prescription opiates, heroin, and synthetic opiates. And there's been a lot of polydrug use, meaning that a lot of users use more than one drug at a time. However, there is a significant amount of stigma attached to drug use and overdose, and the stigma continues to hinder access to treatment and healthcare and perpetuates a cycle of harm. Policies and intervention must address the systemic issues that exist while also providing support to the survivors, especially mothers. Helping mothers navigate the intersection of grief, stigma, and the broader social impact of drug overdose is the main topic of my proposal. Which brings me to my research questions, which are how do mothers cope in response to the death of their child due to a drug overdose? And how can we provide long-term services to bereaved mothers? For my study, I wanted to create something qualitative. So I chose a qualitative longitudinal design, which will track the evolution of coping mechanisms in mothers over a year. My plan is to conduct 6 creative workshops over this year, every 2 months, followed by semi-structured interviews. The creative workshops will offer a safe and unique avenue for participants to communicate their thoughts and emotions, particularly those that might be difficult to express verbally. Gathering a rich, nuanced data enables a deeper understanding of the psychological and social factors that influence a mother's long-term coping. The study findings will be reported through data tables, a narrative report, and artwork with the consent of the creator. Participants will be mothers under the age of 65 within 20 miles of the Syracuse, New York radius. These mothers must have lost a child, someone under 30, to drug overdose within the past 15 years. My goal is to recruit about 9 to 15 participants with convenient sampling at support groups and local mental health centers, as well as purposive and snowball sampling through local agencies and support groups. I really want participants who want to be there, and participants who want to share their experience. However, using this type of sampling makes it so I can't generalize my findings to the entire population. On the left corner, um, on the bottom left, I attached a chart from one of my sources which tracks the way drug-related deaths affect a family. And as you can see, the drug-related death is at the top, and it leads to grief, a cascade of grief, and a disruptive family system. And there are a lot of factors that go into healing a whole family system after a drug overdose. But I want to focus specifically on mothers for my proposal because mothers have a emotional bond with their child, and I feel as though mothers might have a more emotional experience. Um, so therefore, focusing on these mothers and the creative workshops, I will use the thematic analysis to explore patterns and create codes. Some of the codes could potentially be color, symbolism, or motifs used in the artwork, as well as verbal insights such as emotions and perspectives. However, with each artwork and each interview, I have to take into contextual factors with each analysis. And I will analyze the data until saturation is achieved, until there's nothing more that I can do. My findings will contribute themes, narratives, and artwork to inform tailored support services for grieving mothers and understand what they're going through on a deeper level. These creative workshops offer a safe haven for mothers, while these follow-up interviews unveil the emotional and psychological layers of their coping. Therefore, this takes a holistic approach to understanding what the mothers are going through. However, in the qualitative nature of this study means that my findings cannot be generalized beyond the participants, as I mentioned before. The longitudinal format, which means that it will occur over a long period of time, requires commitment, which may lead to participant dropout over time. Another risk is there are emotional risks inherent to exploring sensitive topics and traumatic events. For a lot of these mothers, the event of their child dying is very, very traumatic, and it might be harmful for them to relive that. So that's something we do have to take into account. And additionally, so that's something we do have to take into account and also provide support for mothers that might need the extra support or might have an emotional experience. Additionally, the reliance on creative workshops and verbal explanations might not fully capture the experience of participants who are less comfortable expressing themselves artistically. So this study is geared towards mothers who naturally express themselves in an artistic way. And the implications of this could so the creative workshop approach demonstrates the therapeutic potential of art in processing, offering, and grief processing, and offers a model for similar programs. Insights into the evolving nature of bereavement guide long-term support strategies. The study's focus on the often overlooked population of mothers emphasizes the need for more inclusive research and resources. These creative workshops offer a potential model for services provided to mothers, and it analyzes the effectiveness and what and it shows what art therapy and what maybe like expressing yourself through art can do for healing. And that's why I chose the title A Tapestry of Healing, because I feel like it really demonstrates that this is a artistic creative this is a creative endeavor, and therefore this is suited for people who are artistically inclined. However, I feel like this can provide a lot of insight on art therapy and the therapeutic potential of art in the grieving process. And through analyzing these artworks and these interviews, I will be able to better understand holistically, a whole person experience, what these mothers are experiencing and how we can help them in the best way possible. Thank you for listening, and if you have any questions, please let me know. Have a great day.